today we're going to be learning to really do some interesting work on the shu points of the back. It's setting us up for an afternoon protocol, which is based on resetting emotions, changing some aspects through the whole body, the sanjiao, etc., that have been gone out of whack because of emotion, stress, etc. But before we can do that kind of work, we do want to be able to do something more tangible with the back and the shu points. And understanding it's not just a technique, but how we might change technique depending on whether we are on that upper jiao or upper shu points, middle jiao, middle shu points, or lower jiao, lower shu points. It is important to remember that a lot of the work we're going to be able to do, we can transfer immediately to someone who is very ill or anything. It doesn't have to be emotions whatsoever. But we do need to understand that if the qi is very depleted inside, what is the best way to say this? I want us to picture, we're going to pretend it works this way, right? This is an analogy. This is not actually how it works, but it is how it works. Okay? But the organs are inside the body, okay? And they have a robustness to them, the qi, okay? And as we mature and grow from childhood to robustness, that qi comes up and it reaches all the way up through and it touches the skin at the closest place to those organs, your back, okay? So the shu points are a place where the qi has come up from that robust organ. Now you might ask, isn't it better if you treat children, you can use, Tuinan, it works so well. So how come their qi isn't there? It's very easy. A child's skin and bones is shrunk to the organs, right? And then they grow and the organs fill and they come up. So now, here are these ribs. We have a way to say hi to the qi of the organ because the organ's qi is out here. Then something happens and the organ gets irritated, sick, angry, it's inflamed. And so that qi is going to be pushed further out. And we could use the shu points to drain or to communicate or to change the qi of those organs. Because it's pushed so far out, any work we do is going to make a change. And if we do intelligent work, our change is predictable and much more effective. In deficiency, the qi of the organ is not going to reach as well here. So we can get on here with moksha, with slow work, with burning mountain, with gentle work to coax and know that it will get down there. It can't get down there quickly because there isn't the qi pushing up, right? Excess, you can do things very quickly, right? Gua sha, traditionally, that's what it was for. There's excess qi of the organs or in the channels on there, and you guad it all the way. Now, gua sha, it's almost like it's a fancy medicine. That's grandma medicine. And when I was learning it when I was 20, you wanted bronze coin, the old coins, right? Bronze was there. A lot of superstition, plus you want a cool metal, right? You don't want a metal that's going to warm up as you do that. And I was taught to do that until it bruised and bled, okay? That's how you take down a real fever with gua sha. But like gua sha now, it's just basically strong massage, which is nice for some people. So we're getting sidetracked. But that qi is pushed up through the ribs. It's very fast to drain. You hit it right away, but there's so much of it, it may take time to treat. So remember, in excess, you hit it fast, it takes long to treat. In deficiency, that qi is shrunk in, and so it takes a long time to get to it. You have to do the work. Moksha, liniment, warming, good qi, burning mountain. But once you hit it, the organ will go, ooh, and respond more quickly, comparatively, than in excess. Does that make sense, the yin and yang of how that works? So if we're going to be working and we're going to have the shu points, now what if the problem is that the qi is there, the qi is there, it's not too much, it's not too little. I mean, maybe it's a little too little, maybe it's a little too much, but it's not illness level. but the chi's not moving. They're not communicating. So instead of going around the loop of the five elements, of the organs, it's everyone's just kind of going, and it's stuck. Now, of course, some is always moving. If it didn't move, you would be dead, but not enough. So there's a kind of a backup or a stagnation in every area. Or maybe they're all just a little deficient, that there isn't enough to get to the next organ in a manner that makes it interesting for the body. Then our work on those shoe points is much more working the channel, so that we're saying hello to every organ on the way through repetitively, that it's almost like when someone takes the piano, and then, I guess it would be this side. Right? We work that Taiyang channel on the back over and over. You can see I'm used to the head being here, huh? It's like, and it's like, hello, lungs, pericardium, heart, diaphragm, hello, and all the organs like, whoa. And then they all go, okay, I feel better. I got a little life. So that's using shoe points in a channel line. Okay? So we can do that kind of work. We can wake everybody up, ding, 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 and get it going. But a lot of times, first, we have to just say hi. I go running to this fast. It's like, whoa, what was that? Okay? If I go right into a technique at the spot, the rest aren't communicating. So that one spot has some work, but it doesn't flow down the line. And so, one of the most important things, if you spend time with me in the clinic, is you will see me often either rub, massage, and press down the Taiyang. And for those of you who've been in enough courses with me, you'll hear I push the spirit back into the blood. That's the language I like to use. And if the spirit and the blood are traveling together, all of a sudden it's awake. Now anything I do will be more effective because I'm not losing time for it to say, what's going on? Oh, that's happening. How do I feel about it? I have now communication, and is the next organ down the line going to hear me?